I'm sorry. Hello, everyone. Thank you for being here today. Welcome to our webinar. Thank you for your time. Thank you for joining us in this webinar. I'm Dr. Manoela Malta. I'm the Global Product Manager for Health Sciences, and I'm glad to be here today to share some knowledge, to some experiences, and to advance with you. Advance together in the use of simulation in our programs. So I'm so much hoping that you enjoy this webinar. I would like to thank all Australia team for this incredible collaboration. It's been such an exciting experience for us, and I hope that you enjoy it as much as we do. I would like to also thank Dr. Carlos Aguilar from Mexico and Ana Midens from Honduras, who have supported us in our webinars for Faculty and Academic Leadership Development Program by Laureate Health Sciences. I would also like to thank our team of specialists in simulation that are with us in the chat. We have here Dr. Patricia Greff. She's here today helping us with the chat, responding some questions, and also Dr. Carlos Aguilar. He will help us with the questions in the chat as well. So I also would like to thank Dr. Francisco Gutierrez. He has trusted us and he has worked with us very close to develop this program. So Dr. Francisco, thank you very much. And I would like to remind you that we have a chat in the right side on the screen where you can interact. And you need to connect with your Gmail account to interact in the chat. So your participation is very important for us. Well, I'm going to share my screen with you. Okay. So today we are going to talk about how to facilitate learning sessions using different simulation modalities. This webinar is part of the instructor level of Faculty and Academic Leadership Development Program by Laureate Health Sciences. And by the end of this level, you will be able to facilitate a test training and a simulation scenario. You are going to receive some readings recommendation, and the next step will be a face-to-face conference and workshop when you will be able to have several practices and hands-on experiences. Well, our webinar will have 4 parts. In the first part is what is simulation and why simulate. The second part is simulation modalities. And the third part is we are going to talk about low complexity simulation. We are going to talk about test trainings and how to facilitate test training sessions. And the final part, we are going to talk about complex simulation scenarios, and we are going to discuss the management from briefing to debriefing. So, what is simulation and why simulate? In Laureate Health Sciences, we have a learning model that we call Laureate Learning Model for Health Sciences, or LLM, that's composed by 5 components. So we have new structure and function that we already listened about this with Dr. Vivian. We have systems integration and interprofessional education. We have simulation labs and methods, stronger external links, and high-quality clinical and professional education. In the right side of the pie chart, you can see the results of applying this model. Although simulation is used as a methodology for clinical and professional education, its importance in the Laureate learning model is so expressive that we have dedicated an entire slice of this pie only for simulation. We have advanced a lot in trainings, in innovation, and I'm not afraid to say that we are worldwide leaders, not only in using simulation as a learning methodology, but also in innovations in simulation. We have advanced in simulation in areas out of medicine and nursing never thought before, such as psychology, veterinary, naturopathy, physical therapy, nutrition, biomedicine, and others. So this is an invitation for you to join us in this amazing journey. So, in Laureate Health Sciences, our curriculums are organized in curricular blocks. Each block addresses different themes, such as behavior and society, biological foundations, structure and function, practices and skills, etc. But what it has to do with simulation? In Laureate Health Sciences, for us, simulation is not an event or something that happens as a show, or if we have an extra time with our students. For us, simulation has to be inserted in our curriculum, especially in the blocks of practice and skills and supervised internships, the yellow block and green block, because simulation is part of our students' journey to become competent and ready to their professional life. Okay, but finally, what is simulation? So let's start with a dictionary definition that says that simulation is an imitation or enactment as of something anticipated or in testing. So here we have three words that I like much to explain simulation. We imitate the real life, we anticipate future events, and we test possibilities of response when we use simulation. But let's move to some other definitions that are specific about simulation in healthcare. Here we have two classical definitions, but I want you to keep focusing the yellow words, okay? As you talked before, simulation is an imitation or representation of something. We are imitating the real life in a safe environment, and this is very important because we provide our students the possibility to learn and to make mistakes in a safe environment. So simulation can be used in education, assessment, research, and health systems integration. And here is the core of simulation. The core of simulation purpose. This is the patient safety. The other definition says that simulation is a technique, not a technology. It means that simulation can use technology, but not necessarily. Simulation replaces or amplifies real experiences. We already have a publication that shows that we can replace up to 50% of clinical hours for simulation in nursing training, for example. The experiences in simulation are guided and well planned. And here is another nice word about simulation: interactivity. So during a simulation experience, the students interact with the scenario or test training practices and receive feedback from their own practices. It means that simulation moves professors from the facilitator's role, moves professors to the facilitator's role and puts students in the center of the learning process. So here we have a quote that I like much that say, I heard and I forget, I see and I remember, I do and I understand. So simulation is an opportunity to learn about how to do something by doing something. So, but you don't need to believe me now, okay? Let's start asking why. Why Why should I dedicate some additional time to run simulation scenarios? Why should I change my usual way to teach and insert a new methodology in my classes? Why should I leave my comfort zone and get into an extra work? So my friends, I would like to start giving you 2 good reasons. Do it for the patients and do it for the students. So let's start with the principle of non-maleficence of Hippocrates. And it says, primum non nocere. It means first, to do no harm. This is the first principle. If you can't cure your patients, at least do not harm them. It should be our main and biggest guidance in healthcare, right? But is it what really happening in hospitals and healthcare centers? Well, I think I have bad news for you, my friends. Let's explore some information about this. A recent publication from 2016 showed some scary numbers of preventable errors in hospitals. Listen to me, I'm talking about preventable errors, not destiny, not fatalities. I'm talking about errors that could not have happened. I'm talking about 50 deaths every hour. I'm talking about 1,200 a day, 8,400 a week, and here we already have twice as many people dying of preventable hospital errors weekly as the servicemen that died throughout the entire Iraq war. It's very serious. And 35,000 deaths a month because health professionals are committing preventable mistakes every day, every hour, every minute. In this same publication shows that medical errors are the third leading cause of death in the US. It's very serious. It's in front of respiratory disease, car crashes, and everything. So, but medical errors are not only damaging people, they are damaging country finances. So companies, governments, and citizens are spending millions and millions of dollars because health professionals are committing serious mistakes. So here is an interesting Canadian study that shows that inexperience generates a feeling of incompetence in novice therapists, and that those feelings can negatively influence the therapeutic process and lead to professional mistakes. So premature early termination, alliances rupture, and untimely interpretations, disengagement and withdrawal, and ethical breaches and misconduct. So everything caused by the feeling of incompetence. So simulation can prepare better professionals who will commit less mistakes. We can say that simulation saves lives and save much money. But we also need to do it for our students, okay? The same Canadian study shows that the feeling of incompetence increases the level of anxiety in novice therapists, they experience stress, burnout, depression, low self-esteem, and premature career abandonment. And what I want to tell you that according to our experience, simulation is an efficient methodology to train professionals that will be ready for practice when they graduate. That way, we will increase self-belief, mental health, and well-being, and professional success for our students. But we have more reasons to use simulation in our classes. Let's check it out. So, I don't know if you remember, but I can remember some of my favorite games when I was a little cute kid, don't you? So, what if I told you if they were preparing you for your future professional and personal life? Let's go with me to check them out. Do you remember how many fake meals you prepare when you were a little kid? Now, what you do every day? I bet every day you prepare something to eat, no? How many dolls you took care of? Now the dolls cries louder, make huge mess, make you laugh and cry, and obviously make you explode in love. But believe me, you were following your instinct and training yourself for this huge challenge in your adult life. How many of you perform amazing lectures in front of your little siblings and teddy bears? Now, what are you doing every single day in your professional life? We are all professors, right? And at some point, maybe we knew that and we were training ourselves to perform well in our professional lives. How many of you perform amazing in complex medical procedures in dolls, teddy bears, and I must confess my favorite, little brothers. Now we are all health professionals performing procedures and taking care of people in hospitals, in health centers, and taking care of real people. So what I want to say is that we always knew that doing what we intend to learn is the most effective way to learn something. Take a look in this pyramid and see how much we retain about knowledge, about from what we say and do. So every time we simulate the real experience, we are able to remember up to 90% of our experience after 2 weeks. So we always knew that simulation is a natural way to learn. So why is simulation an effective way to learn? First of all, you can customize learning experiences according to your students' needs or according to new health demands, new diseases, new procedures, new demands in healthcare in general. In a simulation session, your students learn from mistakes, and it's a very effective way to learn, right? Simulation prepares your students for their first times. So imagine your students meeting a patient for the first time, but they never did it before. So you can imagine the environment of unconfidence or lack of self-belief, and we can create better environments for our students and for our patients when we use simulation. Simulation offers a wide range of accessible learning opportunities, since you can simulate almost everything. And rarely you are going to meet a disease or a clinical condition that you cannot simulate. And simulation transforms a team of experts in an expert team, ready to work together to provide the best care to the patient, etc. As we discussed before, simulation puts the students in the center of the learning process. It means that we are talking about an active methodology. It promotes collaborative learning, and which prepares better our students to work with other health professionals. It provides early experience, early practice. It means that we can provide our students with meaningful practical experiences since the first semester by using simulation practice. So when they reach the the internships and the professional life, they are prepared, they are experienced, and they don't need to wait for the internships or their professional lives to have practical experiences. Finally, simulation involves students in a cognitive, affective, and psychomotor experience. They think about something, they feel the experience, and they do something according to their knowledge and feelings. And it makes a simulation experience something absolutely unforgettable. So I like much these testimonials. They are real testimonials from our students and faculty members. And they recognize that the students are more confident by using simulation when they are in external practices. And they say that we cannot go back to the traditional way. And I need to agree with them. By participating in simulation practices, our students become more aware about their own gaps, technical gaps, attitudinal gaps, and emotional gaps. We have seen many students looking for personal therapy after simulation scenarios because they realize that their own feelings, their life story can influence their performance as health professionals. They feel unique because nobody does what we do, and they feel the experience as immersive, powerful, and unforgettable. So this is one of our scenarios. It's a third semester scenario for psychology program. We still didn't have a simulation lab in this institution when we took these pictures, but we always had there much excitement from professors and students. So here is the testimonial of this student. Here is the student, third semester student. She came from other institution, and obviously in that institution she didn't have any kind of simulation practice at all. And what I think that's amazing in her testimonial is in red. And you can see that she's talking about how early she got into a practical session. And she talks about how impacted she was for this experience. And the most beautiful part of her testimonial was when she said that the simulation experience confirmed her desire to become a psychologist. So when we use simulation, we clarify talents, we develop skills, we help our students to meet their way, to meet their talents, and we really transform the journey of our students. Finally, simulation develops not only technical skills, okay? We are obviously develop technical skills with test training sessions, which are also simulation, but using simulation, we can develop a wide set of soft skills. We have leadership, teamwork, communication, problem solving, interpersonal skills, and everything we can develop by using simulation. And here is a quote from one of our professors that I like very much, and she used it to say that simulation is a 3D learning experience. So it's immersive, it moves your knowledge, it moves your feelings, it moves your actions. So everything is put together to provide an amazing experience to our students. So I'm gonna make a break to review the chat and to see if I can help you respond some questions, and then we can go back to the presentation. Let's see. Welcome everybody. Example of psychology students highlights your comment that simulation is an approach, not technology. This was a big learning for me. This applies to all our health courses, not just nursing. Yes, Natalie, many people ask me about the use of technology and very complex labs. And my experience with simulation was starting doing simulation without labs. It was a great learning experience because we had no labs, but we started doing simulation anyway. We had excited professors, excited students, so we had the opportunity to keep focus on the methodology, to keep focus on perform good debriefings, good briefings with standardized patients, and using standardized patients in our sessions a lot. So it was a great experience. So I think we don't have more questions, and we can go back to the presentation. So let's talk about simulation modalities. When we talk about simulation, we have two groups of practices: the test training practices and the scenario practices. Both are simulations. We need to have it in mind because sometimes people think that test training is not simulation, but it is simulation. It's a kind of simulation, okay? Some literature calls low complexity simulation for test trainings and high complexity simulation for simulation scenarios. So as this slide shows, we have test training, and for simulation experiences, we have complex simulation scenarios, interprofessional simulation scenarios, virtual simulation, standardized patient scenarios, and hybrid simulation scenarios. We are going to talk about each one of them in more detail, but we need first to think about the difference between test training and simulation scenario. Well, the first difference is that test training develops and improves isolated or integrated skills, while a simulation scenario is focused on decision-making, management of several skills previously developed, and behavioral skills in general. It's a more complex situation that should be managed by students. The other difference is about how students get feedback during those practices. As we are going to see more details in some slides ahead, during a test training session, the feedback comes not only from the simulators, but also immediately from the professor. While a simulation scenario, while in a simulation scenario, the feedback comes from scenario and from the other students during the debriefing session. That's going to be facilitated by the professor. Test training is mainly focused in psychomotor aspects. Although we are already developing some different test trainings that are not only focused on psychomotor aspects or skills. We have developed some test trainings related to interview, psychological probes, or active listening or something like that. And so we are innovating again. And when we talk about simulation scenario, we are talking about an experience that articulates cognitive, affective, and psychomotor domains. So in test training practice, all students are going to train all procedures. They are going to visit all stations, and every single student is going to perform every single task in the session. But when we are in a simulation scenario, we are going to have some students or one student working in the scenario while the other ones are observing, and they're going to discuss the performance and how the scenario was developed during the debriefing, okay? And finally, test trainings are more focused in procedural skills, while scenarios are going to develop professional attitude. Well, what is a test training session? Well, this is a kind of simulation, as I already told you, and it allows for repeated practice of basic skills. And I would like to make a little break here. This is a definition in the literature, but actually we are not going only to have basic skills in a test training session. We may have very complex skills, but we can isolate them in a station, and our students can train each skill by chance at time. So they are going to use test trainers, simulators that are going to ensure patient safety and comfort for the patient. So we can use mannequins. For example, we can use mannequins to train CPR, lumbar puncture, intubation, etc. Or we can use peer-to-peer. The students are going to work in pairs to train, for example, anamnesis, physical examinations, and other non-invasive procedures. So we need to work in small groups per station, and we are going to train isolated or integrated skills, which is a little more complex. And here we can get the students prepared to the more complex experience, which are the scenarios experiences. So here, all students are going to train all procedures exhaustively. So this is a very important word when we talk about test training. We are going to talk about this further in some minutes, but just keeping in mind, when we talk about simulation, when we talk about test training simulation, we are talking about exhaustive practice, exhaustive training, because we want our students to develop mainly psychomotor skills, okay? The next simulation practice is the virtual simulation, and we have had some advances and advancements in virtual simulation, and it's about a simulation that involves real people who are operating simulated systems. So we can include here surgical simulators that are used for on-screen procedural training and are usually integrated with aptic devices. We have in some of our institutions some aptic simulators for dentistry, and they are really amazing. The students can train the psychomotor skills, and they develop super fine coordination, and they can pick up some cases, and they are going to look to into a screen, and they can see perfectly a mouth in real size, and they have the tools that they are going to use, and they are going to have the exact feeling that they would have if they were in a real practice. So virtual simulation is based on virtual environment. It can be used for task training. I mean, we can use virtual simulation to develop psychomotor skills or simulation scenarios. And we can use virtual simulation for decision making, clinical thinking, procedural skills, communication, etc. And it may allow for multiplayers depending on the objective of the session. So here we have the standardized patient scenario. We have used a lot this kind of scenario, especially when we have the experience that I have in the past, which was we don't have labs. So what we are going to do? And we can use standardized patient in many alternative environments and facilities. So we can build a scenario in a classroom. We can build a scenario in the street, in the parking lot, in several environments and facilities. And standardized patient is a healthy person who is trained to portray the personal history, physical symptoms, emotional characteristics, and everyday concerns of an actual patient. So this is an actor. This is not a sick person. This is not a person with a real clinical condition. This is a healthy person who was trained to portray a patient or a clinical case. So the disease is not real, and it doesn't allow for invasive procedure. We use standardized patient for examination, history taking, communication, etc. And sometimes it's a little bit challenging because we need to keep in mind that a simulation scenario needs to be realistic. So when we use a standardized patient, we need to have in mind that it needs to be realistic. So sometimes I see some people using students from the same group to be the standardized patient. So what I want to tell you is that it's not. I do not recommend it because it's not realistic. So imagine that those students were together in the movie during the weekend, hanging out and talking about their lives, their friends, and suddenly one of them becomes the patient. It's not realistic and it's not good for the experience. So we can have some strategies such as inviting students from other programs and give them some certificate for extracurricular hours activities, or some other strategies that can help us to find good standardized patients and to keep the realism of the scenarios. So the next simulation modality is the complex simulation scenario. It's actually a scenario that requires the management of multiple skills and usually involves technology, mannequins, etc. And it gathers procedural and behavior skills and allows the performance of complex interventions. So we have here a very realistic and complex situation that involves many tools, many equipment, usually involves technology and everything. So it's very well known in simulation. We are going to see many pictures. We are going to listen about this kind of scenarios in seminars, events, and everything about simulation, because it's very characteristic, let's say, of simulation. So, but in some programs, we have some challenges to use this kind of scenario because We don't have, for example, some mannequins for some programs, and we need to adapt some things. And I think it's nice because it challenges us to discover new ways, to propose innovations, to propose different ways to do this kind of scenario. So, an interprofessional scenario is another simulation modality, and it brings together students from different programs to work together in the scenario. And this is not a technical scenario, okay? It calls for communication, teamwork, interpersonal skills, etc. And sometimes it's very challenging to put in practice because of the huge logistics. You need to gather students from different programs which have different classes agenda, and you need to combine professor times. So sometimes it's a little bit challenging. But here we can also find some alternative ways, right, to perform an interprofessional simulation scenario. So we have had some experiences with actors. So we put students, and the other health professionals are actually actors that are going to portray health professionals, okay? So they can discuss clinical cases, they are going to develop communication, teamwork, interpersonal skills, and here is a very interesting finding. It shows some information about the root cause of sentinel events in hospital. So, according to this study, the main cause of sentinel events in hospitals is communication. So we have some interesting publications that shows that interprofessional education and interprofessional simulation improves communication between nursing and medical students, and actually it's going to improve communication, relationship, it's going to improve respect between those professionals, because sometimes we see that in some universities, students from medicine and nursing, for example, or other health professionals even meet each other during their program. They even know each other. They are not friends. They do not talk to each other. They do not have courses together, and they do not study together. They do not discuss clinical cases together. And it's very serious because those professionals are going to work together for the entire lives. So simulation can improve this. Interprofessional simulation can give our students the opportunity to start experiencing the relationship, the co-work since early program. So let's take another break to check the chat and see if we have some questions. Let's see, Dr. Francisco Gutierrez. Thank you, Dr. Manuela, for this wonderful webinar. The simulation, we are so glad to share with our colleagues in Australia session. Thank you very much, Dr. Francisco. Thank you for being here. It's very nice to have you here. We are very excited, and we are glad to be in touch with our colleagues from Australia. So our graduates from Think Health and Torres University will be very well prepared for practice. I agree. Let me see. Question from Kelly Galvin. I have read that simulation experiences in education can highlight different differences in cultural communication, understanding, etc. And this becomes an important consideration. Yes, Kelly. We have, it's a kind of mainstream to say that we are in a globalized world. So we are in touch with people from different parts of the world, and we need to work with them, and we need to prepare our students to work with them. And simulation can highlight those differences, and simulation can prepare our students to manage those differences in their professional lives. Natalie says, so all students understand the scenario process and the expectations. Have you experienced this at your university? It's the same question. When I was in Brazil and in my institution, we were not using to have many students from other countries, but we had students from very different socio-economic realities. So it's highlighted in the simulation experience, and we can discuss about this. We can put it in the on the table, and we can all discuss together and think together about how to manage those kind of issues, and we can improve relationship, communication, and everything. Dr. Carlos Aguilar in Mexico, we have some scenarios intended to manage adversary communication skills in different social and cultural circumstances. Yes. Simone, good question, Kelly. As we have come across some incidents in the clinic environment around culture that students were not necessarily prepared for, and the simulation would have done so. Yes. So as I mentioned before, simulation is going to prepare students not only for technical skills, technical procedures, but it's going to prepare students to be better as professionals, as people, why not to say. And because they are going to communicate well, they are going to have better relationships with patients and colleagues, and it's really worth it. So I think we can go back to our presentation. So let's talk about task training in more details, and let's talk about how to make it happen in your classes. I want you to keep in mind these 4 keywords when it comes to task training. So we have here checklist, demonstration, exhaustive training. Do you remember that? And immediate feedback. These are going to see the 4 keywords that we are going to have in mind during our discussion. So guys, can you imagine the astronauts going to the moon without a checklist? It looks that we are talking about something very important, right? So checklist is very important to clarify the procedure and to guide your students throughout the practice. Sometimes it's hard for us to develop a good checklist because since some procedures are already automatic for us, we simply don't think about them. We just perform them, and it's exactly what we want to happen to our students. We want them to reach the automatics related to those procedures. So we want them to get so familiar with those procedures that they don't need to think about them. That's why we do task training. But they need good guidance, okay? They need good checklists, they need good guidance. So provide them clear and good checklists in advance, and for them to get familiar with all those step by step. And you can also share the demonstrative videos in advance, as this one that I'm going to share with you.
Show you how to do a lumbar puncture. You want to position your patient either in lateral recumbent or, as shown here, sitting upright. This patient prefers to sit upright. Now, either way, you want to have them arch their back and flex at the hip, and that's going to increase the distance between the spinous processes so your needle can more easily fit through. If they're sitting up, you can have them rest their feet on a stool, and then they can rest their head and their arms maybe on a table in front of them. Now, you can also consider giving them a little bit of benzodiazepine to help them through the procedure. Let's take a look at the real procedure done by Dr. Jordan Hark. Whether the patient is upright or lateral recumbent like this patient, identify the landmarks by palpating the posterior superior iliac crest, and where they meet in the midline should be L4, which is good. That's below the termination of the spinal cord, and we don't want to poke the spinal cord, so place a mark at this level. Clean the skin with antiseptic solution, and drape the patient to give yourself a sterile field. Anesthetize the skin with a wheel, and then the subcutaneous tissue in the tract that you're planning to pass the needle. And
so the videos are very important for our students to see the procedures, but just take care about the videos that you are going to recommend. And the best scenario is that you record a video for your students. You are the professors, you are the person that you are the people that they trust. So that would be nice to have your own videos to share with your students. So we have the readings. What do your students need to read to get prepared to get ready for the practice? Which books, articles, publications, and any other materials that you may want your students to read in advance? Do you remember the other word? Demonstration. The demonstration is very important here, and you need to ensure that all students will be able to see your demonstration and explain what you are doing while you are performing the demonstration. So the demonstration comes in the beginning of the session. I'm going to tell you a little bit more about this, and you need to ensure that all students are seeing the demonstration, that your students have time to make questions, to clarify doubts, and that you explain the demonstration while you perform the procedure. In a test training session, your students need to train exhaustively until they develop the skills. They can do it in mannequins or peer-to-peer, but they need to have time to repeat the practice. And I'm used to say that a test training session teaches your body what to do. So imagine that you are learning about how to drive a car, and in the beginning you even know that you don't know how to drive. Then you discover that you don't know how to drive a car. You will start learning about how to drive, and you will start being able to drive, but you need to think about everything, about all movements. You don't want anyone talking to you. You don't want to listen to music. You don't want anybody making any noise around you, because you are very concentrated in every single movement. But as you get familiar and as your body learns all those movements, all those reflections, and you don't need to think about this. You can let your body do the job. So you can listen to music, sometimes you can talk to people, you can get a call, and your body still knows what to do. So you are only able to do this because you train exhaustively driving a car. So you need to provide your students with this experience. They need to be to have time to train exhaustively, and give them immediate feedback. Be close. Do not let them to train in mistake exhaustively, because if you let your students to perform bad any kind of procedure, and you let them to train exhaustively in a wrong way, you are teaching their bodies in a wrong way. So it's very, very difficult to go back after your students learn in a wrong way. So be close, give them immediate feedback. You may want to count on advanced students to help you on this. Correct them, give them as support as they need, but talk to them, be close, do the procedure with them if it's necessary. But they, especially in the beginning of the training, they need very close, immediate feedback. So, how to manage a test training session? The first thing I want to tell you is that a test training session does not begin in the day of the test training session. It begins 1 week in advance. So 1 week in advance, you need to share with your students the rules. So the dress codes, the times, the attitudes, and everything they need to do about the rules. You share with them the readings, everything they need to read to get ready for this practice. You share with them the checklist. Do you remember the checklists? So you need to share the checklists in advance for them to get familiar, to explore the checklist, to compare the checklist with the literature, and maybe if it's a simple procedure, non-invasive, they can train with their little brothers or mom or dad, and or with the colleagues. And but you need to give them some instructions, and some videos, like we talked before. I'm used to call them video checklists. So written checklists and video checklists. So they are demonstrative videos, as we saw before, and they need to have them in advance so they can watch many times, and they are going to get to the session very well prepared. So what about the day of the session? In the day of the session, we need to get there a little bit in advance, just to verify the lab organization, just to verify if you have all resources. You don't want to get there and do not have the simulators or materials and everything, and the documentation that your students are going to need. They can print the checklist in their houses, but maybe you want to provide some checklists during the session. But they need to have the checklist during the session. So you are going to start opening the session with the demonstration and the explanation. You are going to demonstrate the procedure. You are going to ensure that all students are seeing the demonstration. You are going to explain the step by step. I'm putting my hand here. I'm positioning the patient like this. I'm taking this needle. I'm doing these and these and these. And you need to give them some time to make questions. The second point of this session is to organize the session, to organize the lab or any other facility that you are with your students. So divide students in small groups, depending on the size of the entire group. Maybe you want to split the entire group in two, And you can have a test training session with the half part of the with half group, and the other students are going to get clinical case, case study, or any other activity, while you are with the other students in the test training session. So put one group per station and train one skill per station, okay? They need to be very focused in one skill. You are going to see later and know a little bit more about the integrated test trainings that were developed by one of our institutions in Porto Alegre, in Brazil. And this kind of test training gather different skills, and it involves some decision-making processes in the test training session, okay? But usually, commonly, you are going to train one skill per station. The third part of the session is to manage the session. And here, you are going to provide immediate feedback. If you have large groups, you can, as I told you before, you can invite experienced students to help you, to support you, or maybe another professor, but give them feedback, follow them up for them to develop well the skills you want to. And finally, close the session. Assess learning, clarify doubts, and provide instructions for the next activity. You need to make sure that your students reach the objectives of the session. So you need to assess learning, and you need to clarify all doubts. So let's make another break to check the chat. Okay, let me see. Who creates simulation scenarios? Dr. Carlos responded. Test training helps develop muscle memory. Yes. Thank you for your comment, Andrea. I love the idea of muscle memory. Very necessary for nursing. Yes. How do you handle time and test training with large groups with 60 or more students? Because it's very difficult to have one simulator for each student, but they need time to develop these skills. Yes, Jessie, we usually we split the groups, as I was talking before, and we end up working with smaller groups, because the other half of the group is involved with other activities such as case studies or games or other activities which were planned in advance. So in the station, obviously you are not going to have one simulator per student. We cannot have it, but you are going to have one simulator, for example, per station. And while one student is performing the procedure, the other ones are following the procedure with the checklist and giving feedback to the colleague. And then they are going to rotate between them, among them, and they can switch their turns in the station. Okay, Dr. Francisco says, Manuela, it would be great if you can share an example of that you have used it in the past in psychology, and sometimes it's not clear, as in nursing or medicine. It's maybe similar to some of the needs and the degrees now offered in Torres. Yes, Dr. Francisco, in psychology, we have developed some test trainings. When I started facilitating simulation trainings, I was used to say that we don't use test trainings in psychology. We only use simulation scenarios, but it's not true. Fortunately, we started developing some test trainings in psychology, and obviously not as much as in medicine or nursing, but we have some test trainings about active listening. So students work in peers and they listen to each other, following a checklist. But it's not a traditional checklist, 1, 2, 3, 4, 5. They have a list of things that they need to cover in that encounter with the other person, and they are going to discuss this after the encounter. And we have some other test trainings for mini mental examination. We have test trainings for interview, observation techniques, and we have test trainings for application of psychological tests. So we are still advancing on test training in psychology. We have advanced a lot in simulation scenarios, but this is what we have so far in psychology for test trainings. There are quite detailed class activity plans developed for all types of classes, I think, at one. Is that correct? Yes, Natalie. Actually, in Brazil, we have plenty of documentation, detailed documentation for all types of classes, using simulation scenarios, test trainings, and clinical sessions, and everything. So we have advanced a lot in Brazil with academic documentation. So you are surely going to find very good examples. An example from nutrition. In nutrition, for example, they do many test trainings about interviews, about physical examination, and other kind of test trainings that do not involve patients. For example, they train some food preparation. It's a skill, right? And when we go out of medicine and nursing, we start innovating a lot. So we have innovated in psychology, nutrition, in veterinary, and other, and naturopathy, for example. They can have a test training in Brazil. We have in the naturology program some courses about acupuncture, for example. So they can have a test training for points, localization, for needle application, and for tongue examination, and other kind of test trainings. Okay. Initial rapport with the patient is an example that is repeated across different programs. Yes, Carlos, we have trained our students for rapport and interviews and everything. So if you don't have more questions, we can go back to our presentation. Give me a second. So, Let's talk about complex simulation scenarios, and we are going to talk about the management of scenario session from briefing to debriefing. Here we have four keywords, and I want you to have those keywords in mind now for simulation scenarios. So we have here standards. So we are talking about standardized patients or mannequins. The other keyword is resources. All the materials we are going to need to run simulation scenarios. The briefing, not the briefing. Briefing with students and the debriefing. So these are the critical elements for a good scenario experience, and we need to take care of them. The first critical element are the standards. Here I'm talking how you are going to train the standardized patient or set the mannequin up. Your patient, the standardized patient, needs to know who he or she is. Sometimes I get some simulation scenarios and you are not able to find the name of the patient there. Sometimes you have the initials, but this is not a patient's record, a real patient's record. You don't need to put the initials. You need to put the real name. So your standardized patient needs to know who he or she is. The name, age, past medical history, family history, complaints, medication taken, or treatments. So I like to see that. I like to say that we learn a lot from best practices, but we also learn a lot from worst practices. And I'm going to share with you our worst practices. Okay. So I think 4 years ago, I developed a simulation scenario with another professor. It was a scenario about violence against women. It was domestic violence. So the idea was that the student was going to receive a woman who's just suffered violence from her husband. So the actress had makeup and everything. It was very realistic. She was crying a lot. And we ran the scenario for the first time, and it was fine. It went super well. The student did relatively well, but the patient was amazing. When we ran the scenario for the second time, the student asked the patient about her life story, her family, her parents, her siblings. And when she asked this to the patient, I looked at the other professor and my eyes said, oh my gosh, we didn't put it in the standards. We didn't tell the standardized patient about her family, her parents, her life history, life story. Okay, but the standardized patient was very nice. She created an amazing story that her father was used to be violent with her mother, and she had four brothers, all men, and they were all violent and everything. So the story that she created was nice and was really connected to her violence, domestic violence story. But we needed, I got a little bit desperate because we didn't put it in the scenario, and it may have ruined the scenario. But it went well. But we needed to go back to the scenario and to review the scenario and to put this information in the standards. So you also need to inform about the attitudes. Are they going to look sad anxious, nervous, angry, collaborative. What about the attitude of this patient? How are they going to be dressed, for example? A depressive patient can't be nicely dressed, right? They usually look bad dressed, and they are missing self-care, simple and basic care like showering and brush the hair and everything. They are not going to use makeup. Another thing about the standards is please test simulators and train standardized patients around 3 days in advance and have a plan B, because your standardized patient may become sick, may forget the compromise with you, and you need to have a plan B just in case, okay? You also need to plan in advance the resources. Realism and immersion are two important words when it comes to simulation. So your students need to believe that they are in the real life. That's why details are very important and will make the magic of realism to happen. Pay attention to everything you need and provide all stuff in advance to do not run the risk of ending up without important materials to run your scenarios. So I like very much this quote here, and it says, it's the little details that are vital. Little things make big things happen. So believe me, the small flower that you are going to put in the psychology scenario is important to create realism, to create an immersive environment. The clothes, the furniture, the office supplies, every single resource is going to be very important to create realism and to provide an immersive experience to your students. The other critical element for a successful scenario experience is the student's briefing. What are you going to tell your students? The answer here is very simple, okay? You are going to tell them what they should know if they were in their real professional life. For example, if it's a simulation about the first consultation and the learning objective is to perform an interview, you are only going to say that they are going to receive a new patient and they have only to perform an interview and finalize the scenario. Only that. You inform the time, usually 5 to 15 minutes, and that's all. But if the objective of the scenario is to communicate the diagnosis and offer immediate orientation, you need to give them more information about the patient. And the scenario is going to begin at the moment when the professional communicates the diagnosis. For example, we had a simulation scenario which the objective was to finish therapy session, okay? So we gave the student all the information about that patient. He's with you over the last 4 months, and in this session he talked about this and this and this and this, and you have 5 minutes until the end of the session. You have another patient waiting for you outside, and you need to finalize the session. So the thing here is that when we have about 3 or 2 minutes to finalize the session, the patient says that, start crying and says that she was abused. She suffered abuse, sexual abuse, when she was 11 or something, and the student need to handle this situation and finalize the session and let it as a topic for the next session. So Tell your students anything they would know if they were in their real professional life. And take care of the time. It's very important. I have seen some scenarios with 45 minutes, 30 minutes. And what I want to tell you is that long scenarios are going to make you to lose focus and get distracted from the objectives. So a 5 to 15 minute scenarios is usually good to cover the objectives, okay? And now let's talk about the core of the simulation, and it's the debriefing. Here is where your students are going to have insights of learning, and where the learning of, and where they are going to reach the learning objectives with your help. We have here some definitions, but I want you to keep focused on the red words, okay? So we have here the word conversation. So the briefing is a conversation among people who have just had a simulation experience, a scenario experience. And we have here another word that I like much is explore. During the briefing, your students are going to explore and analyze the experience. They are going to analyze actions, thoughts about the processes. They're going to analyze and think about their emotional issues, their feelings, and everything to improve professional performance in real situation. In the other definition, we have here that the briefing is a learning experience through reflection. So the students have the experience in the scenario, and then they're going to reflect about the experience, and they're going to build a strong learning experience by discussing in the debriefing. And here they are going to share experiences, they're going to gather information and develop ideas for the future, because they are going to discuss what they would do differently and what they're going to be differently in the future when they are in the same situation. And here it says that the briefing following a simulation event is a conversational period for reflection and feedback. And here is something very important, that the feedback in the briefing comes up from the students. It's a collaborative learning, it's a collaborative experience. And it's also important to tell you that we have in the literature different debriefing modalities, but and the different debriefing modalities are going to cover different situations or different types of students groups, and we can use the different debriefing modalities, but actually we have used the reflective debriefing a lot, because it allows our students a deeper reflection about the experience. So we have here 4 main features in a debriefing. We have the briefing is a structured conversation. We have a structure. We plan in advance according to the learning objective, and professor is now a facilitator. So we are not giving a class, you are not giving a lecture or a conference to your students. You are going to facilitate their conversation. You are going to make questions. You are going to provoke them with some reflections, with some comments, maybe with some questions in general. And it allows for critical reasoning. So, the main objective of the briefing session is to promote insights of learning. I mean, your students need to be able to say what they learned from the experience. However, they first need to be aware about what happened here. So sometimes we do some things and we do not realize that we did those things. So if we did something wrong and we do not realize that we did it, we cannot analyze what we did. We cannot learn what should be done differently. So the first phase in the briefing, we are going to help our students to be aware about what happened. So here we are going to clarify what happened by asking something like, could you describe what happened here? Or you also need to ask, you also want to ask them something like, what did you feel in this scenario, in this experience, or how do you think that your feelings interfere in your professional performance? And it's a very nice question because your students start realizing their own life stories, their own emotional gaps, and usually they start looking for help, sometimes psychological help or medical help or counseling or something like that. So now that they are clear about what happened, you can start facilitating a discussion about the performance. Start asking about what was good. And why is this so important? If you start asking out what was not good, you can create a defensive environment. So start asking about or talking about what was good, what was very nice, what can be taken as a good example of practice, a good practice. Then you move to another level of discussion, which is, let's analyze what happened here. So let's talk about the diagnosis. Let's talk about the patient's attitude, how to manage this attitude, or how to communicate. And let's talk about what the literature says about this clinical case. Let's talk about interprofessional interactions, probably, and which professionals could help you to take care of this patient, and other reflections about the case. And this part of the briefing is very oriented to the learning objectives of the scenario. And you are going to close this phase of the briefing talking about what could be done differently. And see that I'm not talking about what was wrong or bad. Let's talk about what could be done differently. It's a different way to do, or we can do it better. And so you create an environment of confidence for your students. So now that they are aware about what they did, they were able to analyze the performance, and so they are able to have insights of learning. They are able to reach the learned objectives and to evaluate, to make a synthesis and to evaluate the experience that they just had. So you are going to ask them, what did you learn from this experience? What are you going to take with you to your professional life? So this is the master point of the briefing, and you can see the insights of learning. So here we have some tips for a good debriefing. I'm used to say that during a debriefing session, professors are going to be questioning 25% of the time, and students are going to discuss 75% of the time. Do not give them answers. It's very hard. It's a big challenge for us as debriefing facilitators, because your students are going to ask you, okay, so tell me what I should have done here. What's the right answer? And it's very very difficult for us to not give them the answers because we are professors. We are used to give them answers. But my suggestion is let them to go back home feeling uncomfortable about their gaps of knowledge. Let them go back home feeling that they don't know something, and then tell them where they can look for the answer, good readings, papers, books, and everything, and start the next session with a good discussion about their doubts. The other tip is avoid negative words like, you did good, but. So when you use but, you are invalidating the previous talking. Or you did wrong, you should not have done this. So try to create a safe environment. Remember, simulation is about safe learning environment, and simulation is about learning from mistakes. So try to involve all students as much as possible, of course, and be one of them. Make a circle, sit with them in the circle, not stand in the front of them as if you were giving them a conference and everything. Praise what was good. It's very nice practice during the briefing session. Respect the phase of the briefing and be objective. As we saw before, the 3 phases of the briefing have pedagogical logic. So please follow them. It's very important to record the simulation session, and you can go back to the video at the end of the session during the debriefing to clarify some doubts and be clear about the rules. They need to respect each other, the mistakes are welcome, and the students will find a way. So you don't need to give them the answers. So sometimes we are afraid of the new things. Sometimes we are afraid of trying something for which we do not feel comfortable already. But you know what? I would like to invite you to start today. Even if you are not feeling ready, you are going to feel ready as you make mistakes, just like our students in the simulation practices. As you use more simulation, you are going to see students more prepared, motivated, engaged, and different in terms of attitude. But there's another thing that we're not going to see, but it will happen for sure. You are going to indirectly save many lives by training better professionals, better health professionals ready for competent practice. So if you want to know a little bit more about simulation, you can access the Laureate Health Sciences Toolkit and other readings recommendations that we are going to share with you in a couple of days. And here is the link for the toolkit. And we will be always available for you to support you, to help you, to clarify doubts, so you can reach us every time you want and need, okay? So thank you for your time. I'm going back to the chat just to see if we have more questions. Dr. Francisco is asking, in your view, for a professor that has never facilitated a scenario, what does it take to prepare her to have confidence in doing it? Your experience with professors, please. How to start? So it's a very good question. Sometimes professors feel a little bit insecure to start with students. So maybe you want to have some sessions among faculty. Maybe you want to test some scenarios among you among professors and discuss about the experience and feel a little bit more confident about this. And then you can start with a small group of students, and why not to explain them that you are starting to use this methodology and you are all learning together. And I like to be transparent with the students and with everybody, and it helps a lot. Do we have more questions? I don't think so. So thank you very much for your participation. Thank you for being here today. Thank you for your questions, your interaction in the chat. And as I told you, we are going to be available for you to support you in everything you need. And you can contact us anytime you want, okay? Thank you very much. Simone is net, and I will compile any further questions from the Australian team. And okay, Simone, I'll be waiting for your questions. Okay, I'll be glad to help you. So have a good day, and I hope to see you soon. Bye.